for this important conversation. So before we get started, just a little bit of housekeeping. So we kindly ask that everyone keep their microphones muted throughout the presentation and during the Q&A. That way we can ensure we're accommodating all of our attendees and that we'll have a good, smooth running session. And also it'll make the recording after the fact that much more consumable and easier to listen to. So if you have any questions, which are absolutely invited, encouraged, even begged for, please use the Q&A function instead of the chat in order to submit those questions. You can submit those questions at any time during the call, and you can even go ahead and upvote certain questions. If you see another attendee post a question that you think is interesting or important or relevant, or you share that question, please use that function in order to help us prioritize which questions to address during our time of Q&A. You'll see a little thumbs up icon that you can use to upvote those questions. So if we don't get to your question during the webinar, please don't worry. We'll follow up with a blog post addressing any lingering issues in the coming weeks. So before we dive into the presentation, a little bit about the Guinn Center itself. We are Nevada's only nonpartisan statewide policy research center. And since 2023, we've produced more than 45 policy reports and briefs, and we have plenty more on the way. We conduct policy research on the economy, education, healthcare, good governance, land use, and everything in between. And in today's session, we'll be highlighting our latest analysis of the 2025 to 2027 Biennium budget. One key focus will be on how HR 1 is poised to impact Nevada's budget and when those changes are scheduled to take effect. We'll also address some topics and questions that lawmakers should consider as those changes are rolled out. But first, we'll present our usual historical comparison to help you understand how this biennium's budget stacks up against the last. We'll take a look at general fund revenues, expenditures, and also some key takeaways. And we'll wrap things up by briefly touching on some other factors that could otherwise shape the biennium's budget, whether it's allocations of state funds to cover gaps during the federal government shutdown or the upcoming Nevada legislative special session. We also have some exciting upcoming research projects we just want to touch on before we get started. This November, we'll be releasing a brief on AI in K-12 education and its policy implications, followed by a December report on AI in healthcare. And in January, we'll release an analysis of Nevada's Native American fee waiver system. And in the first quarter of next year, we'll publish a report on federal funding's impact on the nonprofit sector. Very excited about that follow-up analysis in particular. And finally, I am delighted to introduce our speaker today, Mark Krmpotic, our Interim Director of Economic and Fiscal Policy, who went through a lot of, who faced and bested a lot of tech gremlins to be with us today. Mark brings with him decades of experience and is a trusted authority on the state budget, as you can see on your screen. That doesn't even communicate the half of it. We're so grateful to have him presenting on this analysis today, and absolutely grateful to have him as part of our Guinn Center team. So without further ado, I'm going to hand it over to Mark so he can get started.
Thank you, Christine. I appreciate the introduction. And we're going to just kind of dive right into the explanation of the budget. If we could move to the next slide, please. So a little bit of background about the budget that some of you may or may not know about. How appropriations work, for instance. Appropriations are allocations from the general fund or the highway fund that are approved by the legislature each legislative session, and the appropriations fund sometimes specific purposes, but as most of you know, they fund the operation of state government, the operation of agencies in state government, and the various programs within state government, and that the power of appropriation rests with the legislature. Where do some of the revenues come from? Well, we talked a little bit about appropriations just a second ago. With general fund appropriations, the source of funding for the general fund comes from taxes, sometimes fees, sometimes other uses of money. Within the tax realm, we're familiar with some of the major ones: sales and use tax, gaming tax, modified business tax, which is a lot of people refer to as a payroll tax, insurance taxes, and so forth, live entertainment tax. Those, constitute largely the sources of the general fund. The highway fund portion that comes a lot of that is coming from the gas tax, the statewide gas tax, DMV registration fees and licenses, and also the tax on special fuel, which is by and large diesel tax. We've also got federal funds, which make up a significant part of the budget. And those are funds that come obviously from the federal government in the way of grants or entitlement funding. We've got other funds, which are include funds that are licenses or fees that fund direct programs or budget accounts within the state, and those come from outside the state into these programs. Some of them you may be familiar with, for instance, within the Nevada system of higher education, for instance, those would include student registration fees and out-of-state tuition, for instance. We've also got interagency transfers. Those are simply transfers between agencies within state government. Balance forward funding, that's simply a carry forward of funding within the budgets that are authorized by the legislature, and the legislature does authorize the ability of agencies to balance forward their funds from one year to the next in certain circumstances, and to maintain a reserve to be able to carry those funds forward. And then those primarily constitute the largely where the revenues come from. The five primary bills, and then the next bullet point, what expenses are included in the budget under the five primary bills. And those are the bills that the legislature approves each session largely to fund the operation of state government. They include the State Appropriations Act, which includes general fund appropriations and highway fund appropriations to fund the operation of state government. The General Authorizations Act, or otherwise known as the Authorized Expenditures Act. And that bill funds a lot of the other sources of funding that I just mentioned, federal funds, some of the other funds that are coming from outside sources, specifically earmarked to certain programs, interagency transfers, and the balance forward funding. We've also got the education funding bill, which includes the appropriations and authorizations that fund K-12 education in the state of Nevada. The capital improvement program budget, which doesn't necessarily include funding to fund the direct operation of state government, but that bill funds capital improvement projects throughout the state, and those projects are reviewed and approved by the legislature each legislative session. And then we've got the pay bill that I'm going to kind of break that down in two forms. One is the salary bill that authorizes unclassified positions throughout the state. And from time to time, when funding is available, the legislature will authorize cost of living increases for state employees, generally speaking. Since the collective bargaining law went into effect following the 2019 session, there is also a collective bargaining bill that the legislature takes up and approves. And there's funding in there for a specific collective bargaining units that are identified in law throughout the state. There's also a 1% COLA included in that bill, which is included in the operating expenses that we are going to talk about this morning. So what expenses are not included in the budget? When we talk about operating expenses, and I just mentioned those in those five primary bills, but there are also numerous appropriations that the legislature approves that are for special purposes or one-time in nature. So the legislature takes up numerous bills that fund one-time equipment purchases that are not included in the operating budget necessarily, or other special purposes that may be identified, fund replenishments for the contingency account and other funds that carry state government forward during the interim. Next slide, please. So this gives you a visual of the various funding sources that I just mentioned and how they make up the state budget. Federal funds, again, makes up the largest portion of the budget at 28.1% of the total budget pie, if you will. Other funds, 26.7%. The general fund makes up the third largest total at 21.8%. Interagency transfers at 12%, the balance forward funding at 9%, and highway funds at 2%. Next slide, please. So in talking about the budget, and we're going to talk about some dollar numbers here as well, the legislatively approved budget for the current biennium now totals $56.7 billion. That includes the funding from all funding sources listed in the subsequent bullet points on the slide. The budget in total increased about $3.3 billion from the previous biennium, an increase of about 6.1%. So what makes up that $56.7 billion? We looked at it on a visual basis in the previous slide, but federal funds total about $15.9 billion and 28.1%. Again, funding provided by the federal government, restricted for certain programs and uses. And you all can imagine that Medicaid funding, Title 19 funding, funding the Medicaid program makes up a substantial portion of that. The other funding piece totals $15.2 billion, and again includes licenses, fees, grants, interest, and in certain cases, gifts that are received by agencies. The state general fund at $12.3 billion, or 21.8%, funded by taxes, fees, and non-tax revenues. A good example of that might be interest income that the state receives. And then the remaining funds, which are lesser in amount, include the interagency transfers, balance forwards, and the highway fund, which we previously mentioned. Next slide, please. So this takes a little more of a detailed look at the general fund specifically, which is always a concern each legislative session. In my previous service, I spent a lot of time balancing the general fund, especially during some very trying times, but as this visual displays, sales and use tax makes up the largest portion of the general fund pot, 30.6%. Gaming taxes, 16.1%. The modified business tax, or what a lot of people call the payroll tax, 14.7%, and then insurance taxes, 11.8%. And the funding splits that you're observing here in this visual include the forecast made by the Economic Forum in May of this year, and with some minor adjustments approved by the legislature. I believe those included some gaming penalties and then a tax credit that was approved by the Interim Finance Committee in June prior to the start of the interim. Next slide, please. So this, again, we're talking about the Economic Forum and the forecast made. Sales and use tax totals $3.8 billion. That's the largest share of general fund revenues. However, I would point out that the Economic Forum, in their forecast for the current biennium, compared to the forecast made for the previous biennium, forecast a slight decrease in sales and use tax in the amount of about $83 million, I believe. And that is somewhat unusual, but as I went through and observed the minutes of the Economic Forum meeting, there was some uncertainty associated with sales and use tax. I think the tariffs were noted and possibly Fed actions going forward. The state gaming tax, again, the second largest contributor at 16.1%. The majority of that is made up with percentage fees on gaming revenue. And then modified business tax 14.7% and insurance taxes 11.8%. And when you look at sales and use taxes and gaming taxes combined, that totals almost just short of 50% of total unrestricted general fund revenues for the upcoming biennium. So these are the revenues going into the general fund, not the appropriations the legislature approves to fund the operation of state government. Next slide, please. And here we're looking at the expenditures by function. This looks at the major functions identified in state government, health and human services, 46.6%. The health and human services function was bolstered significantly to the legislature's formation and establishment of the Nevada Health Authority, which not only combined the Medicaid program, but also the Public Employees Benefits Program and that associated funding, as well as the Silver State Health Insurance Exchange. So on a total expenditure basis, Health and Human Services, by and large, makes up the largest portion of the budget, with the Nevada Health Authority, the Department of Human Services, and the Department of Employment, Training, and Rehabilitation. Education, which encompasses K-12 education and higher education, as well as the Charter School Authority, comes in second at 31.1%, and that is a significant portion of the budget, but that program doesn't receive as many federal funds and other funds, primarily federal funds, as the Health and Human Services and Health Authority would receive. And then we see some of the other functions that make up lesser portions of the total expenditure pie. Elected officials at 7.6%, infrastructure at 5.8%, commerce and industry at 3.7%, and public safety at 3.7%. And I would just add that our report in Appendix B crosswalks these functions to the various agencies and state government. Next slide, please. So looking at the expenditure summary in a little more detail, the core functions, 8 core functions, which we just talked about, Health and Human Services, again, makes up the largest portion of statewide expenditures, with education coming in second. And then it's notable to include that the Health and Human Services and education combined make up just over 3/4 of the total statewide spending in the state. Next slide, please. So what's different in 2025, 2027? I mentioned to you already that the overall increase in statewide funding was $3.3 billion, totaling a 6.1% increase. Again, much of that comes from federal funding, other funds, and the general fund increases. We talked a little bit about this, but the establishment of the Nevada Health Authority was a significant measure that the legislature approved this past session, and that consolidates health care spending in the state, at least the portions that are under control of the state, which include the Medicaid program, the state Public Employees Benefits Program, and the Silver State Health Insurance Exchange. And then I would note that COVID relief programs, which we're talking primarily at this point, the American Recovery and Rescue Plan, budget of $1.5 billion, that experienced that much of a decrease from the previous biennium, really associated with the winding down of that program. You will recall that those funds were required to be obligated prior to the end of calendar year 2024 and are required to be fully expended by the end of calendar year 2026. So the budget reflects that winding down of those funds into the current biennium. Next slide, please. some key takeaways in the budget. Forecasted general fund revenue growth slowed from in the 2025-2027 biennium, an overall 5.5% increase, which is still healthy, especially compared to what the legislature has seen in past years. But compared to the 2023-2025 biennium, where we experienced a 26.9% increase over 2021-2023, it's moderated quite a bit. Again, federal funds continue to constitute the highest share of statewide revenues at 28.1%. The newly created Nevada Health Authority is now the largest department in terms of expenditures, with approximately $21 billion in statewide expenditures for the upcoming biennium. And then the Department of Education is the second largest department with expenditures of $14.8 billion. And again, when we talk about the Department of Education and the levels of funding, we're really looking at the pupil-centered funding plan and the core funding for K-12 education that's distributed to school districts throughout the state. Next slide, please. So HR 1, which many of you are familiar with, House Resolution 1 that was approved on July 4th of this year, implements some changes to the budget that we just talked about in the upcoming and future years. Some of it takes effect this biennium, some of it in out years beyond this biennium. The report looks primarily at the SNAP program, which has been in the news quite a bit lately, and also the Medicaid program. And some of the significant changes with SNAP beginning in October 1st, 2026, the state will be faced with increasing its match for SNAP. And I would just indicate briefly, SNAP stands for Supplemental Nutrition Assistance Program. And that's providing SNAP food allotments to citizens, the needy throughout the state. But one of the significant changes that takes effect October 1st of 2026, federal fiscal year 2027, is the state is required to increase its match for SNAP administrative expenses from 50% to 75%. And based on the funding that's included in the budget for FY 2025, that totals an approximate increase of about $20 million in general funds to support SNAP administrative expenses. And those SNAP administrative expenses, by the way, are primarily included in the Division of Social Services, previously called the Division of Welfare and Supportive Services, and its administrative and field services programs within that division of the Department of Human Services. The other significant change involves SNAP allotments. And I would just point out that while the SNAP administrative expenses are included in the state budget, SNAP allotments do not flow through the state budget. They flow directly to the recipients of SNAP within the state. And the federal HR 1 requires states to provide a percentage of funding for SNAP allotments depending on the SNAP payment error rate. And the SNAP payment error rate measures the accuracy of the state's eligibility and benefits determinations. So higher payment error rates may result in the over or under distribution of SNAP benefits. And in FY 2024, Nevada's payment error rate was 5.94%. The way these matching requirements work is that if a state experienced a SNAP payment error rate of 6%, but under 8%, a 5% match is required. And based on Nevada's total SNAP allotments, which total approximately $1 billion, that could amount to an additional $50 million per year in general funds to match SNAP allotments. If that payment error rate is 8%, but under 10%, that could total, that's a 10% match requirement, which could total $100 million per year. And then lastly, if the payment error rate is over 10%, a 15% match is required, which in Nevada's case, if that were to come into being, that would be an additional $150 million in general funds required to match SNAP benefits in the state each year. There are some other employment related requirements related to SNAP that require adults without dependents, what you might hear in the acronym called ABODs, that require work requirements for these individuals that require SNAP benefits. And that could result in additional cost to the Division of Social Services in meeting those federal requirements. I don't know, and I don't know that the Division of Social Services has had an opportunity to fully evaluate that yet, but that could result in additional fiscal impact to Nevada, depending on largely the Division of Social Services evaluation. The second major area that was impacted in HR 1 that involves the state is the Medicaid program. And there, again, are a number of additional requirements that may impact the Division of Social Services, which is the division in state government that determines eligibility for the Medicaid program. And these include, beginning in federal fiscal year 2030, states must at least monthly determine or verify Social Security numbers of enrollees and report those to the United States Centers for Medicare and Medicaid Services. One of the significant items that was noted was beginning in the first quarter of after December 31st, 2026, so that would be the first quarter of calendar year 2027, states are to redetermine eligibility for Medicaid recipients every 6 months, as opposed to the current practice in Nevada, which is every year, an annual redetermination. And that, again, could result in the fiscal impact of the Division of Social Services and redetermining every 6 months as opposed to on an annual basis currently. The other item, two items of note are again the work requirements that are imposed on the Medicaid expansion population, those recipients that are able-bodied adults without dependents that are receiving Medicaid benefits associated with ACA, and they are required to work at least 80 hours per month. Again, if the Division of Social Services is required to verify those work requirements, it could result in a fiscal impact. I'm not certain. And then the provider tax, which in Nevada, we have a private hospital provider assessment that was implemented, I believe, January 1st of 2024. The legislation passed the previous legislative session in 2023. And that provides supplemental payments to private hospitals, but also 15% of that funding is providing mental health or benefits and services throughout the state as well. So the bill beginning in fiscal year 2028 requires that provider tax must be decreased by 0.5% per year to a minimum of 3.5% in federal fiscal year 2032. And I would note that in our last bullet on page 17 of our report, it's missing that maximum rate must be at 3.5% by federal fiscal year 2032. So I would just note that as a little bit of information that was missing in our report. So it's significant from the standpoint that the provider assessment currently is 7.1% on inpatient services and 6.89% on outpatient services, which are providing supplemental Medicaid payments to those providers, and those would have to be reduced under the requirements of the bill to 3.5% by federal fiscal year 2032. So we could go to the next slide for a second. So some of the questions for policymakers as they evaluate this, and as I noted, some of the implementation dates are close to a year away, but these are things for policymakers to be thinking about in the meantime. And that's what are the minimum requirements, including the fiscal impact necessary to implement the provisions of HR 1 at the state level. And a lot of times federal agencies provide supplemental rules on how those changes in law will be implemented that the states must follow. And performing this analysis early will better inform policymakers ahead of a potential special session. The Division of Social Services, this appears to primarily impact that division under the Department of Human Services. So understanding that prior to a potential special session will very much benefit policymakers in evaluating how to address those into the future. And then what are the long-term positive and negative impacts on Nevada and future biennia? The federal requirements will undoubtedly require, at least at a minimum, with SNAP administrative expenses, additional general fund appropriations to fund that function, and looking into the future as to how the state will be able to afford that within the resources available in the general fund, again, would behoove policymakers going forward and making informed decisions. What are the short-term fiscal impact and implementation timelines on the Division of Social Services and the Department of Human Services? As those of you who are familiar with the budgets and the agencies, additional federal requirements sometimes involve additional information technology programming expenses or changes to those systems, and that requires time on the part of agencies to implement those. And then what's the state's ability to absorb additional program expenses given the current fiscal position of the financial position of the state? I noted the SNAP allotments and the matching percentages that could potentially be impact Nevada and the 5.94 SNAP error rate that was experienced in FY 2024. Policymakers should be asking the division what the current SNAP error rate is for the most recent completed federal fiscal year 2025. When that comes into effect, states will have the option of using either a federal fiscal year 2025 or federal fiscal year 2026 either payment error rate in terms of determining what its cost for SNAP allotments might be. And policymakers should be asking those questions now of that division to determine what may be coming down the road in the future. Next slide, please. Other considerations, the upcoming special session, which is I'm relying primarily on information I've read in the media. The IFC recently approved an excuse me, an IFC allocation of about $30 million last week to help assist Three Square and the Food Bank of Northern Nevada in providing food to the needy, especially those individuals, excuse me, who are reliant upon SNAP benefits. Undoubtedly, in an upcoming special session, the IFC contingency account will require to be replenished to meet the needs of state government over the remainder of the interim. And then with respect to the upcoming special session, we're talking about possibly the possibility of film tax credits, which may impact general fund revenues into the future. There may be a benefit to it, but again, full circle evaluation of how that impacts the state, both positively and negatively. So I think that pretty much wraps up my presentation.
All right, thank you so much, Mark. And as we get wrapped up, I want to take a pause and allow a little bit of time for some absorption. And while all of you absorb the information that was just shared, I'll go ahead and tell you a little bit about what's coming down the pike in terms of further analysis. So Mark is graciously going to continue this work over the next couple of weeks, specifically with a couple of policy briefs and an explainer. So primarily, we're looking at a policy brief on recent IFC allocations. And perhaps, Mark, we can kick off our Q&A time by describing some of those recent allocations from last week in regard to SNAP benefits. But we're going to be releasing a brief on that in the next couple of weeks, just a very quick one-pager to describe what kinds of changes have been made at the state funding level in order to fill in some gaps left behind by the government shutdown. Also, a policy brief on special session outcomes. We do expect the special session to be taking place in mid-November. Again, we're just as reliant on media reports as many of you on the call. All of us are waiting with bated breath to see when the special session will be called. But we will be doing a policy brief about any outcomes from that special session after the fact. And then finally, we're going to be doing an explainer on tax abatements versus tax credits. It's not necessarily going to contain any analysis on the efficacy of one versus the other, but rather just an educational piece to help explain the differences between the two. It's a nice, refreshing piece as we head into the special session as well. So with that, we'll go ahead and open it up to questions. Again, don't be shy. The Q&A tool is open and waiting for you. So please submit your questions as you feel comfortable. But as we kick things off, Mark, let's go ahead and talk a little bit about the actions that IFC took in this past week in order to address funding gaps to SNAP benefits. Can you describe what the Interim Finance Committee did?
Sure. So the Interim Finance Committee approved that allocation from the contingency account. That's an account that's established in statute to meet unforeseen needs throughout the interim when the legislature is not in session. And those allocations require approval by the State Board of Examiners. It's a body that's made up of the governor, the attorney general, and the secretary of state, and final approval by the Interim Finance Committee, which is made up of the members from the previous session of the Assembly Committee on Ways and Means and the Senate Committee on Finance, both major money committees during the legislative session. And so the IFC at its October 30th meeting approved $30 million for allocation to 3 Square and the Food Bank of Northern Nevada. And those two agencies provide an additional safety net for those that are in need, that are experiencing food insecurity. And the allocations were intended to assist those two nonprofits in providing those services and food benefits to those in need. That brought the contingency account balance from just over $30 million to between $2 and $3 million. And likely the legislature at its next special session will be required to, excuse me, I'm sorry, replenish that account. So that's a little bit of just a brief synopsis. There were also some American Rescue Plan funds that were allocated to the Department of Agriculture to meet food benefits, I believe in school nutrition funding and breakfast after the bell funding.
Thanks so much, Mark. Oh, it looks like we've got a question coming in, and it's in regard to the error pay rate. So one of our attendees is curious if we can discuss how we measure the error pay rate and what the causes of the error pay rate might affect either a rise or a decrease in the rate, and how we actually might compare to other states, if you have any scope on that particular point.
So the payment error rate is, I, I can't explain exactly how it's measured or what calculations or data is provided to it. But if one can imagine that the state determines eligibility for someone who is eligible for SNAP benefits, that falls below a certain federal poverty level threshold, and then individuals is qualified for SNAP benefits, and then subsequently um, their income increases, they go to work, whatever might be the case, and would no longer qualify for SNAP. Uh, so in that case, through the eligibility process, the person might have been initially qualified for SNAP benefits or erroneously qualified for SNAP benefits. They're receiving the SNAP benefits, and the Nevada or the state would be over distributing SNAP benefits to somebody who was not otherwise qualified. In my review of the website from the USDA, the SNAP payment error rate includes a composite of both overpayments and underpayments. So underpayments would obviously be not providing SNAP benefits to those who would maybe otherwise qualified. When you compare it, I did a brief review of our comparison in Nevada to other states. I noted that Nevada was at 5.94% in fiscal year 2024. Some of the other states are as high as 10% or up to 15%. Some of the bigger, larger states, I believe Illinois comes to mind as one of those, that if that SNAP payment error rate doesn't come down to a lower level, would be subject to very significant matching requirements for its SNAP allotments. Nevada is at $1 billion in total SNAP allotments, but other states or other larger states, as you can imagine, would be in a worst case because they've got much larger SNAP allotments on an annual basis just based on the number of those SNAP recipients that are eligible. I hope that answers your question.
Thank you, Mark. I think you did a beautiful job addressing that question, and thank you to that participant for issuing that question. Again, I want to invite everyone not to be shy. Please submit your questions while we have Mark and while we have some time remaining in this webinar. While we're waiting for folks to keep chewing on their curiosities, Mark, I'm going to turn our attention back to the growth of the legislatively approved budget in this biennium compared to the last. So we saw an increase of about 6.1% over the previous biennium, which of course you indicated was a slower rate of growth compared to the previous biennium, mostly because of the influx of federal funds related to COVID relief. But when it comes back down to the 6.1% that we identified in this biennium, what again are the main factors driving this growth? And what growth trends do you think are indicated by the 6.1% growth that we saw in this biennium?
So in looking at the growth and overall expenditures in the area of federal funds, much of that increase is associated with Medicaid. I believe the increase in federal funds from the previous biennium to the current biennium was about $1.2 billion. Medicaid accounts for about $1.1 billion of that. So Medicaid funding is providing medical expenses or per capita medical coverage for those that qualify throughout the state. There's also an increase in other funds in K-12 funding. Those of you may or may not be familiar with people-centered funding plan. There is a combination of general funds that funds people-centered funding plan or K-12 education throughout the state, and a number of earmarked funds, including the 75% property tax, the local school support tax, mining tax, the gold and silver tax, and so forth. So those other taxes that are earmarked for the people-centered funding plan are considered as other funds in the statewide source of funds summary. And That accounted for, I believe, we noted about a $600 or $700 million increase. And then also, again, going back to Medicaid, some of that increase had to do with the increase in drug rebates and also the provider taxes that I mentioned. The provider tax went into effect January 1st, 2024, but it's been fully annualized now in the budget in the current biennium, and that those two accounted for about a $600 or $700 million increase in the overall budget. The trends in the budget, you asked about that briefly. A lot of, again, in the Medicaid program, we're talking about caseload growth or increases in per member per month expenses or costs, especially as it relates to managed care organizations, which cover a number of the Medicaid eligible population and the urban areas throughout the state, and also fee-for-service costs that are usually associated with urban areas. So primarily, it's a caseload driven budget and cost per member, cost per eligible driven budget too, or the cost per caseload. In the general fund area, the increases there, not surprisingly, we saw a fairly significant increase in general funds in education, both in K-12 education and higher education, then also in public safety and the public safety function, which when we're talking about general funds, that primarily includes the Department of Corrections as a major general fund user, if you will, in the public safety function. That hasn't been dissected any further, but those are, primarily the areas that accounted for the growth in the general fund.
Thank you, Mark, for considering how future biennia could be implicated in some of the trends that we're seeing in this current budget and what we might expect in terms of growth. So since I don't see any other questions from attendees, we'll go ahead and wrap up with one final question. And we actually might want to go back to the slide with questions to consider if we're able to. I would love to hear from you, Mark, in looking at some of these changes that may seem or feel daunting regarding HR 1. How would you prioritize addressing some of these changes? If you were to start, chipping away at the adjustments that we're looking at in regard to HR 1, where would you start? What would you prioritize first and most urgently?
Well, I would prioritize those impacts that are occurring sooner rather than later. Obviously, it's very good to look forward and determine what the future impact on the budget might be. But the increase in the SNAP administrative matching percentage is coming forward in this biennium. Mind you, we're talking only about 3/4 of a year, but when the legislature convenes again in 2027, they'll be looking at a full year for each year of the biennium, the impact of that for the next biennium after this one. So I always look at what's coming up sooner rather than later, what the state's fiscal position is and how it may be able to absorb that. Are there other changes that may be required in the budget to address or enable the state's ability to fund those requirements into the future? I think it's pretty evident through the IFC's action last week and through prior legislative sessions that the state is very interested in maintaining and seeing that the SNAP program continues and continues to provide benefits for the needy in the state. And so it becomes a higher priority, I guess. That would be the other part of it, other than timing, is both Medicaid and SNAP are very important programs in the state. One provides food benefits to the needy. The other one provides medical expenses or medical coverage for those who qualify. And both of those life factors are very important quality of life factors in the state. So equally as important, but you take them one at a time, starting with how they impact the state into the future and try to understand them as best as possible, and then understand what the federal requirements are for implementing these. Sometimes, and I'm not going to name names or name agencies or anything else, but there was a federal requirement that was put in place many years ago that I had the benefit of examining in my life with the legislature. And the cost of implementation was overstated to a great degree, and it caused a lot of concern on the part of the subcommittee members that agency was assigned to. So it's very important to understand what the minimum requirements are for implementing these measures, and what, again, how the state will meet those minimum requirements in the way of additional funding or cost going forward.
Thank you so much, Mark. I so appreciate your willingness to help prioritize some of these questions for lawmakers. I know this is very much a work in progress, and our public servants have a lot of work to do in the coming years in order to ensure a smooth transition with these changes as they're implemented. So thank you for providing some color, some insight, and some very helpful historical context. So thank you. Everyone, thank you so much for joining us today. We're going to go ahead and close up our session. But before we do, I want to go ahead and invite you to continue to collaborate with us as we perform needed and relevant policy research in the state. And namely, I want to invite you to participate in our annual policy priorities survey. You'll see that there is a slide with a QR code up in front of you that you're more than welcome to access with your mobile device. I've also went ahead and put the link in the chat to the policy research survey. But this is the best way for all of you to engage with us, to keep the conversation going about what policy issues and what critical needs Nevada is facing that could use a good dose of data-driven policy solutions and trusted research. We would love to hear from you, to hear about what topics are on your mind. We don't plan to close this survey anytime soon, so please feel free to chew on your thoughts and respond to us in due time. We'll continue to send out the link on our social platforms and through our newsletter, so please make sure that you're engaged with both. And finally, I want to again thank Mark for sharing his expertise. Thank you to everyone for attending, and we hope to see you at another webinar very soon. Have a good day.